is our last panel discussion. As we approach the final segment of today's summit, we now turn to the most human dimension of healthcare, care that extends beyond treatment to dignity, quantity, and compassion. Our final panel begins together leaders shaping the future of elderly care and mental health, where nurturing leadership plays a defining role, stating, integrating elderly care and mental health challenges, innovations, and nurturing leadership in holistic care. I invite Mr. Subratik Gupta, Chief Solution Officer, Support Elders, to moderate this vital session. I would like to call on a stage all the panelists, Professor Dr. Rajesh Shah, consultant surgeon and medico-legal expert, Professor Surgery and Medical Superintendent. Bring Punita, Technical Director, HRC, Jupaigo, India Country Office. Dr. Kanwar Big Singh, Founder, Ment Health. Professor Dr. Sanjay Rajpal, Country Head, India. Dr. Aman Khera, Founder and Director, Aegis Care Private Limited. I request you all please come on stage.
Good afternoon, everybody. It's the last session. Might be a bit boring, but whatever we have seen today, it's all about the hospitals and its associated organization, and the doctors, nurses, nursing leadership, and all of that. Slightly different to this topic and very important topic, as you can see here, integrating elderly care and mental health. So this is very important subject because as we know that by 2030 or beyond, 20% to 30% of our Indian population will be elderly. And hence, there's a huge challenge for us to make sure that the elders live in their own home. Obviously, when there is a requirement to go to the hospital, they would. But if they can live in their own home, along with the infrastructure, whatever is required to be given at the adequate time, appropriate time, so that they can live with peace, more peace of mind and dignity. So I have a beautiful panel. They are stalwarts in their own field of operations. Sorry. Yeah. In their operations. So I would try to complete it by around 40-45 minutes so that we can take questions if there are any. So I would divide the topic into three major categories. Basically, number one is the challenges what we are facing in the elder care and the mental health, which is very, very important. Number two is the innovation part of it. Number three is the nursing leadership. This is extremely important because that is a part and parcel of the elder care. And then we will conclude. So coming to the elder care, I'll just slightly define in my own way, and then I will put up the questions to the panelists one by one, the queries which I have for them. Elder care to me is basically a combination of physiological care or physiological well-being. Number two, the cognitive well-being, the mental health well-being. Number three, the social well-being. These two are very interrelated. And number four, the activities of daily living or the instrumental activities of daily living, meaning that whether I, as an elderly person, I'm able to do my own work. That means I'm able to bathe, I'm able to brush my teeth, I'm able to change my clothes, etc. So with this definition, I use the term, the acronym PPT. Obviously, we are used to, but this acronym is all about process, people, and technology. So it has to be the right blend of the processes, the SOPs in place, the right people with the correct empathy, not sympathy. And then the technology, obviously. Technology will not guide us in giving the solution to the elders, but it will definitely be helping us, means the doctors. So let me sit down, but I'm not very comfortable sitting down and asking questions. So I'll just tell them. So I'll
So,
just
respected
introduce.
sir, so you want us to stand up as well?
No, no, no.
We will follow you. You are the leader, you are the moderator. So whatever you say, we'll follow. We are all physically fit and stand.
I'm not the leader. I'm one of you.
Thank you very
Happen
much.
to be I'm moderating it. So I'll just go one by one. To my right, I have Dr. Rajesh Shah. Whatever I'm talking about is very less, but yes, I need to. He's consultant surgeon and medico-legal expert. This is very important part in the elder care in Narendra Modi Medical College, Ahmedabad. Um, Obviously, he has been awardee, father of medico-legal science awardee, and founder president of Federation of International Law, Medicine Ethics and Innovation. He was president, very interestingly, he was president of Indian Hernia Society. So it's a unique combination which is there with Rajesh ji. Then after Rajesh ji, it's Dr. Sanjay Rajpal, country head. How to spell that, please? Ipsomed. Ipsomed AG India. This particular organization is a reliable partner for self-care solution. It's very interesting. And this is leading developer and manufacturer of self-injection systems of liquid medication, offering the most comprehensive and innovative platform for pens, auto-injectors, and on-body devices. This is extremely relevant in the elder care spectrum. After Sanjay ji is Dr. Kanwar Singh, founder of Ment Heal. I mean, obviously, whatever I will be telling is very, very less. He is basically different potential he has, is an innovator, one of the side, and also implementer. So I'll just quickly run through. Dr. Kanwar Singh is a healthcare leader in India, integrating mental wellness, lifestyle coaching, social impact, business leadership, obviously political engagement. Founder of Mental, an AI-driven mental and general wellness platform, and the TechnoServe enterprises. So he has got different type of solutions across the spectrum. And then we have Dr. Aman Kera, founder of Aegis Care Private Limited, comprehensive technology-enabled elder care ecosystem that ensures no parent in India ever feels alone. This is very important point. Loneliness is a factor problem in the healthcare journey. By combining preventive care, compassionate coordination, and smart technology, Aegis Care bridges the gap between elderly parents in India and their children abroad, bringing peace of mind and dignity to both generations. And finally, we have Brigadier Punita, Technical Director. Again, I'm not able to pronounce that. It is Japaigo, India, country office. Japaigo India work spectrum is from village to cities. They work with governments and partners to transform health systems so every woman and family get access to the quality and dignified care. So with all this renowned, I would say, people around me, the panelists, I would take the privilege to go to the first challenge. The challenge is in integrating the elderly and the mental health care. So the first is, we have already discussed, previous different panels have discussed on the resource gap. The second is the stigma and ageism, meaning that I am getting old. Gracefully aging is something which we really want to hide and tell that no, I am fine, fit and fine, whereas I am not. Clinical complexity means multi-morbidity is there, which we really don't want to talk about. If there is a physiological problem, we generally go to the doctor and talk about. But if it's something to do with the cognition, we seldom go and tell to the doctor, because we think वो तो पागल हो गया. And that's very derogative statement which we make. The social factors, the loneliness and all of that. So I have a few questions which I would be going across the panel to get their own views. So the first one, how do we deal with this social factor challenges which we just touched upon? So I would request Brigadier Punita ma'am, if you can please throw some light. Obviously, we know that time is shortening.
Hello.
So we need to just go very quickly, please.
Thank you, and I must pay my thanks to organizers who has invited all of us here to present this important topic in front of this August gathering, because it is what the India will be facing maybe next 10, 15 years, and we require to prepare for it from now, even from industry perspective. So when we talk about social stigma the elderly faces, I must say that it is not only elderly, it is the family. First of all, the elderly faces a social isolation. It is not isolation within the community. It is a isolation even within the family, because family members are very busy. All of kids are busy with their education, husband wife is working, breakdown of our joint family system has taken place. So nuclear family, and they are left alone. Otherwise, they are there in the big houses with all facility available to them, but there is no one to talk. So this is one problem which they face. Another decline which occurs, they have another physical illness like diabetes, hypertension, the kidney element. Now this drug interaction is there. At the same time, we have seen that around 80% of um, patient who visit medical OPDs, they have a certain amount of depression in them. Apart from the depression, they also have anxiety, dementia, the forgetfulness. They remember what was there 10 years, 15 years, 20 years before. But immediately where they kept one particular articles in their home, they don't know. And apart from that, the family members don't know these people are facing this problem due to their normal aging. It may not be reached till disease process. It is a normal aging process. So this problem requires a stigma attached. Another big problem which our population faces is institutionalization care is still a big stigma. We don't believe in elderly care home or prepare ourselves for our aging. So
Correct.
these are the few
Absolutely.
things I would like to just bring about. Thank you.
Thank you so much. I would request Dr. Keraji to please throw some light on this particular ageism and the social stigma and the social factors
Hello.
which we have.
I think what Punita ji has said is quite, concise what she has said regarding the problems that the elderly people are facing. You see, what is happening is that now, like she has said, that the families are becoming more and more nuclear. They're becoming smaller. Children are moving out. They are going to other cities, countries for better prospects of life. Elderly people now are eventually becoming, staying back alone. And I'm sure we all see in our families also. See, the elderly people today form the most vulnerable section of the society. The reason is that they have the maximum disease burden on them, as well as when they're staying alone. So their access to the healthcare is also not there, whether it's mental health or whether it is physical health. Now, being lonely, they, in my experience, I've been, running hospitals also. We find that these elderly people do not want to come to hospitals because they have a fear. They say probably they feel that if they come to hospital, some disease may come out and they are all alone. Who's going to look after them? So eventually what happens is they live in a state of denial and they say, fine, nothing's going to happen to us. We'll see when the time comes and we will, reach that situation. Internally, they are stressed out. They are, going through anxiety. They are getting depressed because they know that their physical limitations are increasing and their freedom of movement is also going down. Eventually, this will land up into more chronic diseases happening. This will land up into situations of emergency because they have not been to hospitals at the right time. And again, being alone, they land up in a very precarious situation in a hospital, increasing the morbidity and mortality. So what I'm trying to say is that yes, today the loneliness factor is increasing tremendously. The elderly people are getting more and more withdrawn from the society, and as well as because of the psychological problems and depression, they are neglecting their physical health and eventually landing up into more problems.
Right, absolutely right. Because it's a state of denial that I am fine, but otherwise I'm not.
I think we all at various stages of our life have seen this in our families, whether we see our parents, we see our other elder relatives. Elderly people, they know that there is, they are coming to a stage when diseases are going to happen, but they don't want to accept that. They'll say, I am fine, something may happen to my neighbor, nothing going to happen to me. And that's where the problems start.
I'll request Dr. Senji to please throw some light on this point, whatever you think.
Very good evening. Am I audible? Ladies and gentlemen, the first expression which I use in my life is brain want to be rewarded. 8 billion people across the globe. Everybody has got 1 3/4 of brain. None of them have got the same thought process. Just like fingerprint. So the crux of the life is brain want to be rewarded. So how do we classify this? Suppose you are standing on road, sometime you see a person is passing by and don't know the person who he or she is. But still you feel like I should talk to this guy and you start smiling automatically. And at some instance you find a person is walking, same condition, but you feel like, it doesn't look good, That is what brain is all about. Brain has got a different fingerprint altogether. We have got thousands of perception in our mind. And that is a reason which differentiates us with others. In 2005, when I left my job as an American MNC head, I was just struggling to see that where should I start my career from. I have scrolled almost all the about 20, 30 fraternities which I have been working for last, 30 years now. And I discussed with my wife. So I find out that psychiatry is a subject where nothing or something little has been done so far, with respect not only to India but to the global world. And 90% of people actually they depend upon pharmacology, then gadgets. And again, my life is driven by a lot of expressions, and I use the expression that physics precedes chemistry. So the pharmacology is chemistry and physics are technology. And if you see in the medical fair here in Medica, you will not find a single pharmacology company. It is what? Technology. The head of Messe Dusseldorf is sitting here. He's a German, and know that Germans are known for the technocrat and advancements. I am basically a fan of European technology and American technology. So then I went to US and Czech Republic, and I found out something, what we can do for the people who are suffering in silence. Because anybody who has got a mental illness, be it a child, adult, adolescent, or an elder person, what they are looking for, they are not looking for some medicines. They actually, at this point of time, looking for a shoulder on which they can lie down and cry. And that is what the crux and the treatment is all about. So I identified, along with my wife, we thought that we should dedicate our life to work on the mental health, and we started. So you know how we have started, like, suppose I may be a bit out of context, but actually I am always there for, extempore, and normally, I don't really mug up anything, Suppose when you're running a fever, what do? You take a thermometer, you get to know how much fever you have, so you have the feedback. If you want to weigh yourself, you stand on a weighing scale, you get to know how much weight you have, so that gives you a feedback. But what is happening in your behavior, in your thoughts? No CT scan, no MRI, no X-ray, no ultrasound, nothing undetected. And that is the problem. Whatever technologies we have, they identified, when you do the EEG, simple EEG, you identified he has got a stroke, he got epilepsy, he's got a seizure or a blood clot. Then I worked for the quantitative EEG, whereby I connect one electrode. I went to US, I went to European countries, spent a lot of money learning all these things. I've got one hunger in me, that is learning. I still study about 16 to 17 hours a day. It's about 30 years I am into business now. So I connect one electrode at your scalp and I can tell you how much drowsy you are. What is the level of concentration? What is the level of situation anxiety? Situation anxiety means when I came here, I was having bit of cough and all. So I have taken water, I am feeling okay. But the biggest problem is performance anxiety. That is the biggest problem with our elder people when they are alone. Now I am doing in context to you. So this is what the problem is. Then you get to know how much your concentration is. And you know how much your alertness is. Once you suffice all these things, and you know how I treat it. I treat it with a video game. So normally how you control a video game? With joysticks, mouse, keyboard, nothing doing. You use your brain as a joystick. On my computer, I have got your quantitative EEG of your functional behavior parameter on my screen. On the other screen, you play a video game. Now you have to drive a car on the middle of the road with full speed. So how you do it? You don't have any joysticks. You cannot use your hand. The moment you use your hand, the car will crash. The moment you think something else, the car will go off the track. The moment you take your saliva in, the car will go like this. So what feedback you get? You get the feedback that if I do this thing, I'm not going to get a score. So who has taught you? Therapist? No. Doctor? No. Your inner self had taught you. That is what I named as brain feedback. Your brain is the mirror image of your thought process. Man ke haare haar hai, man ke jeete jeet. If you want to win yourself, you have to be clear about your thoughts, what you are thinking. 90% of the time we are firing in the air. We don't know what we are doing. And if we are not a part of a solution, then we are a problem. Thank you for this point of time. Thank you.
Thank you so much. This is something which I'm learning because I come from this organization called Support Elders Private Limited, where we are trying to provide the holistic care to the elders, which combines all the 4 activities, which is physiological, cognitive, social, and the ADLs. So the same question to you, Dr. Sanjay. So if you can please answer the ageism and the stigma very quickly, shortly, because
Yeah,
we are.
I can understand.
Yeah.
So because my fellow panelists have already shared, but I echo, only I will share my personal example. My mother, she is 86 years. I stay with her. And she has dementia, severe. And frankly, initially, we got MRI done, everything done. And my doctor's friend said, Sanjay, it is only age-related, nothing, no disorder, nothing is to be done. Just this is all. So frankly, initially, when it started, because even sometimes she does not remember me, who am I? Sometimes she forgets. So this is something initially I used to feel bit low, sad as well, or should I take her with myself? I'm a professional, I speak every day on some forum. Even still, I felt, should I take my mom to the park? I know that she will not remember, but later on, even I have to come up, no, Sanjay Rajpal. This is, even if she forgets, so what? She has to go to the garden with me, what's wrong? So this is frankly a learning process for all of us, including me. I'm taking my own example. Yes, this is age related, and she, as a retired school teacher, she has, you can say, taught many children a whole life. She has taught all my brother and sisters, but now this is age related, and my doctor's friend Sanjay, no need of unnecessary medicines. We give her omega-3, everything we give, just to support. But yes, so frankly, I must acknowledge that what my friends have said, it is brain-related, but when it comes to stigma, yes, we all, sometime moment comes, even I faced it. So this is all I want to say. Thank you.
Thank you so much to Professor Dr. Rajesh ji. If you can please throw some light on that.
At the outset, I first compliment Medical Fair India as well as Afzal Kamalji Medgate Today for brilliant idea on elderly at the end of the 3 days academic session. There was a continuous 3 days academic session in this hall, but the end with the life as we end with the elderly care. This is the most important topic and it is being selected. I would request everyone to give a big round of applause for such an excellent idea. This is an era where elderly care, these 3 words he has used. One is elderly care, mental health, and third is holistic health. I think it includes the entire health, wellness, or anyone. So this is the thing. And if I narrate, our Prime Minister, he is from our land, and he has put down from 1st February 2026, there are main 8 facilities available to the senior citizens. Unfortunately, I will still narrate that senior citizen definition is not clear. If you are a senior citizen getting from a Mamlatdar of your Tehsil, the certificate is available at 60 years. If you are working in the High Court and you are a High Court judge, your working is up to 62 years. If you are a Supreme Court Justice, your working is up to 65 years. And you are a professor in the medical college, your working is up to 70 years as far as National Medical Commission is concerned. So, first important thing is required is the regularization of this thing. Second important thing, with 40 years of experience, I would narrate this thing. I would never accept it as a social stigma, which Pratik ji and all panelists has mentioned. It is not a social stigma. It is the golden period of the life, which everyone must enjoy. The end is always there to enjoy. The only truth in the life is death. So we are going towards that. So never have any idea that you are going towards the death. But important thing in your mind should be you enjoy the end of your life where majority of your requirements is over. So this is the important period, and government also has given things. Another important thing I would quote our Deputy Chief Minister of Gujarat, Harsh Sanghvi. Recently his video is viral on the social media also, and it was an excellent challenge in the society. He put down one thing that no person should have any donation, or you should accept, the society should accept the donation from a person who is not keeping his mother and father with him. And this is an excellent challenge. We also should practice this in our life. You should be with your father and mother, and you are not running the family. Your father and mother, who has run the family since years, they are running the family. And if this acceptance in the total society, I think majority of the things are over. One important organization is there in our place, and that is named Prarambha City. They have made one city where the elderly people lives, their all care is taken by the organization itself. Whether it is their food, whether it is their walk, whether it is their enjoyment for screening of any cinemas or anything. So everything is done by them. So enjoy the life, and these are the few concepts where we should accept it under the entire globe. And then we will have definitely a good thing. If we understand the disease process in the life, I have 40 years of experience of medical science, and 95% of the diseases are psychosomatic, as Kanwar Bir Singh also has mentioned this thing. So 95% of the diseases are psychosomatic, and out of psychosomatic, 95% are psycho. Somatic part is only 5% of these 95%. So it is a very small part, and practically whenever your psyche is proper and is healthy, you are healthy till the end. Thank you very much.
Thank you so much. We'll come, and there are a lot many queries which I have, but due to time constraint, I will just move on. Only one question which I want to just touch upon in this challenge section is that we all talk about the elderly care. So I think that is more of a second innings in the cricket terminology, or as a twilight zone. But having said that, what we both require, the aging generation, they need to age gracefully. Number two is that those who are not, they also need to appreciate that one day they will also age. So during this thing, what is very important is the empathy. So that is a challenge. That empathy and sympathy and no sympathy or no empathy is a challenge by itself. So coming to the innovation side, obviously the holistic care in the innovation side, as we have seen today to the whole day, that it has to be a blend of technology and the actual solutioning for the elders. So there I have got one query which I have to put in, and then we will move to the nursing leadership. So there I would put the question back to you, sir, Dr. Rajesh ji, that how do you think that we will be able to blend appropriately the four aspects, that means the physiological, cognitive, social, and the ideal, with help of technology, so that both the empathy is there, the last mile human touch is there, but at the same time technology is there, because technology will never ever replace doctors or nurses. They will help. So how do you think that will happen? Time is running short, so please be very quick, please.
Important aspect of this elderly care and what is required for them. I would not narrate more for the medical science, not the other parts, but the important facet is the companionship. What they need in elderly care is the companionship. They feel entire day alone. Nobody is talking with them. What is required is the time to give them, to have some talk with them, to have to understand their important feelings, and that is the most important part. What as a, suppose my father is there, if I spend 15 minutes, he will be so happy. The entire world will be there with him. So this is the important part of the things, and we all must carry this message with us, that whenever you are able to have a free 15 minutes, 20 minutes, sit with your mother, sit your father, or whoever is elderly available, sit with them and make them to enjoy their life.
Thank you so much. Sanjay ji.
Again, I will share the practical aspect that how innovation or technology in elderly care. We as an organization make pens like these. Frankly, we learned from the users who take insulin that, okay, just they cannot see, visualize it. Then we came with a tick-tick sound as well. But now when it comes to empathy and compassion, then the person who has never taken injection, somebody from family, everyday nurse cannot come. If either daughter, son, daughter-in-law, somebody has to support. But that injection giving only, a simple step, 2 times or 3 times, that requires empathy. So it's a collective effort. Industry can do it. Healthcare professionals can ensure it by educating the family, or you can say as our elderly organizations can do it. It's a collective effort of the society. Alone, one stakeholder cannot bring the change. Thank you.
Thank you.
If you talk about elder care and the mental health, one thing we need to understand that when we are talking about the elders, they are those who have given birth to us. बाप है हमारे, माँ बाप हैं, हमसे ज़्यादा उनको सब पता है. Basically what they are looking for, थोड़ी उनकी भी गलती है, because at some time, because they aspire their kids to be, doing very good in academic and professional life. So 90% of the society where I stay in Delhi, 90% of the society, the children, they stay abroad. And sometime, most of the time, even they are not able to come for the funeral. So we have to understand that what is the stake which we are having. So problem is that in India, we have a mentality of beating around the bush rather than focusing the problem. And I always work on the root cause of the problem. So we have to identify the root cause of the problem. That is number one. Coming back to, because I don't have any product to sell, coming back to this, it is my humble request to the government of India to mandate it not only for the elderly. I tell you, there is a simple psychological problem called ADHD, Attention Deficit Hyperactivity Disorder. So 90% of the pediatric we are focused upon. Has anybody discussed about the adult ADHD, which is the biggest problem? Why you are not successful at your workplace? You are not able to sit. You are restless. You are having high level of performance anxiety, high level of situation anxiety. My kids knows everything. The moment they are put to test, they are blank. When they come back, they say, oh, I have done fantastic. And the numbers are 0, they failed. Why? That is performance anxiety. So we need to enhance our peak performance level, which is required. And believe me, after COVID, sir, with due respect, you have said a wonderful input to us. And I also spent about 15 years in the state of Gujarat. My education is from there. Basically, we need to understand that what is the problem. In the post-COVID era, there is no elder, there is no young. You never know who is going to go at what time. The elder people never thought that they are going to, give a kanda to their kids, which has been happening. I was in charge of Delhi government COVID here, and I was the chief minister representative at that time in Delhi. We have seen more than 20,000 deaths in front of my eyes. So that is a trauma which I can never forget. We need to be collectively doing something really positive, realistic, and actually which is seen on the ground. Not just copy-pasting all the things and just say whatever the other people are saying. We need to be a trendsetter. This is my humble request to the government of India. Prime Minister Modi Sahab is doing a great work, although I am sharing a different political ideology, I am from different party, but still, at the same time, he has funded and he has allocated a lot of funds for the mental health, which is actually the need of the hours. Now, my submission here is that there has to be need to properly allocate that fund to right people so that the right person get the right amount of money. It is not like that, oh, this is on GEM, let's do a 5,000 crore business. Oh, this is on this, let us do 500 crore of business. But are you really helping the people? This is something, because the vision of our PM Saab, sir, 1 second, sir. The vision of our PM Saab is really wonderful, and it is our responsibility as a countryman to make it practically feasible and make it successful on the ground, which is very much possible. I can vouch that with my 30 years experience across grounded experience, hardcore experience, it takes about 2.5 years for India to become healthcare #1 country in the world. I can promise you that. We have got all the blueprint. We know how to do the things. You see the European hospital, they are actually striving. They are struggling. Indian healthcare is far more better. But the thing is that we are not organized. We need to be organized. That is what we need to have. And mental health is something which should be the priority of each and everybody. अगर आपने भगवान ने भी हमारे को सर सबसे ऊपर दिया है. So this is the thing point which thinks everything. So we have to make this in order. If that is in order, we'll live a very good life. Thank you very much for everything, sir.
Thank you. Yeah, Dr. Kiraji.
Thank you very much. I think your question has two very important aspects. One is how, like you said, how mental health, whether it's like physical health and social health and all are to be managed for the elderly, and the other part is about the technology, right? So let's first understand one thing very clearly, that mental health, whether it's psychological, the physical health, the social aspect, the activities of daily living and all, they are all interrelated. We have to understand that. Even the World Health Organization very clearly says, what is health? Health is a state of mental, physical, social well-being. It's not just that if you are fine today and your blood pressure is normal, you are healthy. No. It is not mental or physical or social. It is mental and physical and social well-being. So all these three things are related to each other. We all have seen all these things in our daily life, in our families and extended families. I'll give a very quick short example. Elderly people, as I said previously, have a very major disease burden. Some of them are incapacitated, some of them are bedridden, some of them have a difficulty in walking and moving around. So eventually what happens is, now why I'm saying this is I'm showing you the correlation. That will give them a state of, make them go into a state of depression that they are not able to do their normal work properly. That will make them go into a state of social isolation because they will not like to go out of the society and show their disability that we cannot move out properly. The third and a very important fact is that they will not go to hospitals and meet doctors for their regular checkups, which is going to make them land up into either have chronic complications, long-term complications, or maybe land up into emergency situations. So all of these three things are correlated to each other. So as a result, there is no one point system in which, okay, fine, we look after the mental health, other things will manage. No, we have to have a comprehensive approach, and that's where the question of empathy comes, which is going to happen through caretakers. Caretakers need not be just the appointed nurse or a attendant. Caretaker can be at your home. Your family member is a caretaker. If the person can look after the elderly person, make sure that, okay, fine, whether they are parents, the children can say, let's go out to a social function. That makes them feel a little happy. They think that, yes, we are able to move out. If their activities of daily living are going to be taken care of, they'll feel happy, they'll feel comfortable, they'll be able to take bath properly, go to toilet properly, their mental and physical health will improve. These caretakers will also take them to hospitals for regular checkups and make sure that they are, they have their medicines in time and their regular checkups in time. That will lead to a good health or a better health. I won't say good health, but a better health with chances of lesser complications and lesser chances of, reaching into hospitals and emergencies. So it is going to be a comprehensive approach. But what are the challenges? There are two very important challenges. One is the quality of the caretakers, the training of the caretakers. That's where, again, the empathy word comes, because they have to know that they have to be, how they have to behave or how they have to deal with the elderly people, their requirements. Like initially somebody had said, like the fingerprints are different. So elderly people have different requirements. So what are the requirements for the elderly person which I am taking care of? So that is where the right training has to come in. The second very important challenge that comes in this is that the elderly people are averse to have any caretaker. We have all seen in our families, if we ask our elderly person, suppose our parents are staying alone, and they say, okay, let's keep a caretaker, they'll say, no, I don't want anybody with me. Because they feel that their independence and their is going to get, somebody is going to govern them, and they are going to be dependent on somebody. They don't want to do it. So that is another very important challenge. So that aspect covers the first part of empathy and all. Now the second part of your question was about technology. Now technology going today as well as going forward is going to play a very, very pivotal role on the elder care management. I am talking of not only mental health, because if I talk about health, mental health becomes a part of that. What are the challenges? We do not have the access to right kind of healthcare. People living in, please understand how many elderly people are staying in rural areas or in small villages and towns who have got no access to healthcare. But everyone today has a smartphone. Telemedicine is a very, very important aspect through which the mental counseling, connecting with the right kind of doctors, connecting with the right kind of specialists can be done. As a result, that's where they are able to connect with the doctors, and which are going to help them in connecting to the right kind of service required or maybe early detection of problems. Second thing which is very important is the absence of data. We do not, how many of us have got our reports from last 5 years? None of us. How many of the elderly people are going to keep their reports from last 10 years? They have the maximum disease burden, but where are their reports? Where are the records? We do not have them, or it is all fragmented. So elderly people move from one town to another, they don't carry the reports, but if they have an emergency, then what? So the cloud services, that's where the role of technology is coming. The cloud services help in storing of data, not only storing of data, free flow of information from one service provider to the other. And also the data analysis and trend analysis, how the management of a particular patient is happening.
Dr. Kira, it's only 11 seconds, so please.
One more quickly. It's the remote, again, see, technology also shows how we do remote management by vital monitoring using ECGs and pulse oximeters, and so that we are able to monitor the health of the patient sitting remote. This is what technology is doing. Along with that, there are fault indicators and all. So these all help in managing the health of the patient as well as then eventually the mental health also.
Okay, Brigadier Punita, obviously I'll put a different question to you because
I just want to add
Yes,
one
please.
to
Yes,
this. When we talk of health, the spiritual dimension of the health also required to be looked into, and that becomes a very big chunk of care for the family members, even the community members when they take care. And today the society is shrinking. They are living in the high-rise building where lot many functions are celebrated. Invariably what happens, the elderlies are left at home. So we need to encourage from each age group in that society that not only family, there is a club, the generation need to be talked and they need to be integrated into the system, and some time should be given to them to voice out, to speak in this type of forum so they feel belong to. And technology, of course, like you have chatbot, you have watches, you have everything can be integrated. And the people who are living alone, there is a devices where the real-time monitoring can be done.
Yes,
So,
we have
and we can reach out.
Right.
That's it.
Thank you. I know. I require 2-3 minutes, please. 3 minutes max. Right. Coming to the last point on the nursing leadership, Dr. Kera had touched upon that the caregiving. So to us, jointly as a group panelist, we think that it is not only the nurse per se, it is the nursing. So it's basically caregiving. So there are questions, but I'll not touch upon that because it will overshoot the time. So what I can summarize is that quality of life as defined by WHO, which encompasses these 3 or 4 parameters, need to be done, need to be established for every elders in our society in India and abroad also, along with the challenge of providing and evaluating the caregivers, their level of frustration, their level of involvement, so that the caregiving is being done, monitored remotely, so that the perfect blend of all the 4 parameters, that means, again I'm repeating, the physiological, cognitive, social and ADL and IADL, with the help of the first thing which I said, PPT, the process, people and technology. So technology means that it will be doing some remote health monitoring, remote cognitive monitoring. There are applications in the app which will take our face contour and find out that whether I'm sad or happy or angry or a normal. And obviously, there has to be a physical check by the caregivers initially, and then go to the doctor, and do not be shy about it. So it's a everlasting debate, and this will continue over time.
Can I just add
Yes,
2
please.
lines?
Yes, please.
I just wanted to say that when we talk of geriatric care, it is a multidisciplinary team. It is not only caregiver, it is a general physician, it is psychiatrist, psychologist, social worker, even the geriatricians who are specialized in geriatric aging process, and geriatric nurses. Not to forget that our 80% population is in the rural area, which is governed by public health system, which is Aam Aadmi, the previously used to call sub-centers, now it is Arogya Mandir. So there they are governed by ASHA worker, the ANMs and the community health officer. So now these people require to be trained to identify, like Government of India is screening for diabetes and hypertension. In elderly, they need to be taught how to screen for mental health issues, psychological issues, so they can be referred to appropriate center. And this integration has to take place at PHC, the district hospital, medical, H-RON. That's that I just want to say.
Yeah. Sorry about it. ठीक है.
Thank you. Just 30 seconds. पैसा वसूल होगा सबका. Remember to take away of life. If you see the movie actor, they are called actors. It means they're not real, they're acting. Similarly, don't get fly away or drive away. It is artificial intelligence, not the real intelligence. Mind it. There's somebody who has fed all the data. It's a chat GPT, somebody has fed it. So the natural intelligence can never ever, it always be there, an artificial thing can never ever influence. It can be a short driven, but we have to see the pros and cons also. So at the end of the day, the God which has given you, same पौने 2 किलो का जो दिमाग दिया है, काम इसी का ही सारा होना है. So rely on this, and but yes, use the artificial intelligence and chatbot and grok all this thing for your supplementary thing or the cooperative thing. Thank you very much for your time.
Thank you so much, panelists. I'm privileged, and thank you, the organizers, the 3 organizers here, and thank you so much.
check. Thank you so much, sir. आप सभी से मैं एक बात शेयर करना चाहती थी. मैं अगर आप लोगों की इजाज़त हो तो मैं ज़रूर शेयर करूँ अपनी बात. मेरी जो अम्मी हैं, मेरी माय मदर, वो डॉक्टर्स को डॉक्टर्स नहीं कहती हैं. वो हमेशा कहती हैं ये डॉक्टर नहीं है, फरिश्ते हैं, क्योंकि ऊपर वाला खुद तो नीचे आ नहीं सकता, वो इंसान के रूप में डॉक्टर भेजता है. तो ह्यूज राउंड ऑफ अप्लॉज हमारे सब डॉक्टर्स के लिए, हमारे सारे लाइफ सेवर्स के लिए. So, may I request Mr. Rudy Gall to please join us on stage for the facilitation ceremony and photograph. Thank you so much, everyone. Just one thing. थैंक यू सो मच एवरीवन। मैं प्रोफेसर डॉक्टर संजय राजपाल सर से रिक्वेस्ट करना चाहूँगी कि आप ये किसको देना चाहते हैं? एनी क्वेश्चन एनीवन? सो यस सर।
I'm afraid none of the speakers have touched the topic of spirituality or meditation in elderly care, which is very relevant, I think. Please.
That was a part of my. I was about to speak that, but there was a time constraint. Sir, I was going to talk about that, but there was a time constraint, so I just clip it off.
सर योर नेम? कॉन्ग्रेचुलेशन सर। तो आपको हमारे डॉक्टर सर
आप सर को, हाँ वेरी गुड, चलिए यहाँ बुलाइए, सबको यहाँ बुला लीजिए। आइए।
Hello.
Hello.
Yeah, sir, one feedback. Sir, I like you touch my heart. Yeah. Today, Siddhi Baat, no bakwas. So one unit, my experience which I want to share is
Please.
because it is very correlated with all you people is when the second phase of COVID, I nearly touch death. But after that, once I come out of it, I started one clinic called Loneliness Clinic. But it is so complex, it's so complex that unit you can't, it's specifically in Noida, but we can't increase it to the major part of the, because it's so, as ma'am told, you are very empathetic, ma'am. So as you told that unit, there are multiple people required for this. It's very, unit, I find out and I want answer if anybody can give me solution for that. How to increase that? How can we reach out to more people since it's a very man-oriented job to take care of elderlies in the society? Not from their own parents, but as a startup or as a unit, as an organization which wants to work for them. Thank you.
Thank you so much for your important question and your comments. And you have also earlier, so you won a book from Mr. Sanjay Rajpal. Thank you.
I think what you have to do is you have to be in touch with. I think what you have to do is you have to be in touch with more elder care startups, and especially the ones who are opening elder care clinics, because that's the place where the loneliness clinic, what you are starting, will be useful. So you have to scout around, and it's all over India. Maybe start with your regional wise, that where are the clinics are there or where the elderly people are more. Maybe you can talk to the elder care homes where they, where there are a lot of elderly people. So I think that's a bit of exploring you'll have to do. But yes, that's a very, very amazing thing you have done. I must congratulate you, because that is the need of the hour for the elderly people.
Congratulations, sir.
Just a second, just a minute. Those, what's your name? Deepak Kaul, you have narrowly escaped, as you said. So it is not like you escape. It's the mean that God has chosen you to be here and to do some constructive act. And I'll be your partner in crime for that. Okay.
I would like to call you all on stage. Please, एक photo session के लिए आप लोग आ जाएं. After that, you can ask. Please join us on stage. All the audience are requested, please come on stage. आप सबसे रिक्वेस्ट है जो भी हमारे थोड़े से शॉर्ट हाइटेड हैं वो आगे आ जाएं, जो हमारे लंबे लोग हैं थोड़े पीछे हो जाएं ताकि पीछे वाले भी दिख जाएं। Not body shaming, I'm just saying. So, are you ready, guys? Okay. Say cheese. Be happy faces. अब हमारा अलविदा का टाइम हो रहा है तो एक छोटी सी प्यारी सी स्माइल हो जाए आप सबके लिए। Big. Thank you so much, sir. So, जैसे कि अब ये मैं हिंदी में ही बोलूँगी, हमारे जैसे बॉलीवुड की स्टोरीज में और मूवीज में दिखाया जाता है कि हम वहाँ बाय नहीं बोलते हैं, हम बोलते हैं दोबारा फिर मिलेंगे। तो नमस्ते, सत श्री अकाल, अस्सलाम वालेकुम, दोबारा ज़रूर मिलेंगे। थैंक यू सो मच फॉर जॉइनिंग अस the Healthcare Leadership and Nurturing Excellence Summit 2026. Thank you so much, everyone. So please make a huge round of applause कि आप लोगों ने हमें ज्वाइन किया, आपने एंजॉय किया। थैंक यू और इतनी सारी चीजें सीखी। थैंक यू सो मच। जोरदार तालियां हो जाएं खुद के लिए।
See you soon.